Africa Update.
Hi, thanks for having me.
Now, the theme this year is Unite for Change, Empower Communities, and Redefine Priorities for HIV/AIDS. How important is redefining priorities for HIV/AIDS in South Africa today?
Well, we're in a situation with our HIV response at the moment where we're having a lot of challenges and we have to do more with less, with all the funding cuts from the US and the rest of the world. This involves ensuring that prioritization is done using evidence, using data, using science, also listening to community voices. And so part of the purpose of meetings like this is to start to develop some consensus on what those priorities need to be.
And you've just touched on something that's very key, the recent funding cuts for HIV/AIDS programs. This has raised concerns, and how is the conference going to address the impact of these cuts, and what strategies are being proposed to ensure that sustainable funding for HIV programs in South Africa continues?
Yeah, absolutely. The funding cuts have been a massive blow for South Africa and regionally. As the conference, we are bringing together a range of different sectors, including important government and policymakers, people from the private sector, from the research and scientific communities, and from communities themselves. And we're asking some of the hard questions. We're asking, how should we reimagine our HIV program in this context? And we're asking, what is the role of prevention with the tight budgets that we have? How do we bring in AI to help to advance our needs whilst keeping communities involved? So that's really the main talking points that we have, and it's all going to address all of the funding challenges that we find ourselves in today. A lot of the work is to make sure we prioritize the correct things and don't drop the achievements that we've made already.
Now, speaking of achievements, South Africa has made strides in HIV research, including a groundbreaking HIV cure trial in Durban, that's in the KwaZulu-Natal province of the country, showing promising results for antiretroviral therapy, drugs, control. Now, will this trial and its implications be a focal point at the conference, and how can these findings be advanced to benefit broader HIV management strategies?
So the cure itself and cure research is not really a focal point of the conference. We're focusing more on prevention modalities that are kind of closer to access already, that are closer to South Africans. And that's things like long-acting PrEP. However, what's so critical about this cure trial and what we will be talking about at the conference and what we really need to remember is that investing in research, investing in researchers, investing in research infrastructure is absolutely essential so we can have this kind of science and so that we can advance the cure agenda and the vaccine agenda.
Now, young people, sex workers remain highly vulnerable to HIV/AIDS. What specific initiatives or discussions at the conference will focus on engaging these groups to enhance prevention, treatment, and advocacy efforts?
Yes, so these are really important groups, and we are really pleased to have them participating in the conference. We have members of sex worker advocacy community here, and we will have a speaker from Sesonke, and that is a sex worker advocacy group helping us, attending, speaking, ensuring that scientists and policymakers get to hear what sex workers actually need on the ground in terms of prevention especially. Something I also want to mention about young people is that Dira Sengwa has got an emerging leadership award that they put forward, which will be presented on the final day. And it's a monetary award that will help to advance leadership of young people in the sector. And the candidates are really wonderful.
Community empowerment, a key pillar of this year's theme. How will the conference promote community-led responses to HIV/AIDS? And what practical steps can be taken to ensure communities are equipped to lead in the fight against the epidemic, and also just considering that stigma is still a major problem when it comes to people accepting and just being open about what is happening with their lives.
Yes, we owe a lot of our achievements in the HIV response in South Africa to community groups. And I think what's really important to understand is that a lot of the time, especially recently, some of the funding to help keep these groups going has been coming from the US or from the other funders around the world. We need to make sure that we fund community groups. They can't run on air. We need to fund them to enable them to work collaboratively with the Department of Health so that we can advance with the right voices being in the right places. And so I think that's a really important thing to understand, is that communities can't just organize and thrive. We need to support them and we need to help fund them.
And just in wrapping up, Dr. Rees, with global and local stakeholders gathered at this conference, how will this event foster collaboration between researchers, policymakers, and advocates to address both the medical and social determinants of HIV/AIDS in South Africa?
Well, that's what these meetings are all about. It's important to share and disseminate science and knowledge. But more than that, it's getting different people into the room together who don't normally sit and work together on a day-to-day basis. It's fostering links. It's understanding. And so that's how the meeting advances that collaborative agenda and starts to become a kind of touchstone for these collaborative work that goes ahead. So I think really it's all about crossing over, coming together, getting to know each other.
And what are you finding just in reading the room? What sort of mood are you finding? Are people open to, the possible discussions that may be taking place or what it is that they're there to do?
Well, that's another reason this kind of conference is so important is, we've had a really tough year as a group, as an industry. And so to be able to draw some energy and some optimism from each other and some drive to move forward is really important. And so I feel like that is what is happening. People are feeling energized by being together.
Well, Dr. Rees, hopefully we'll be able to touch base with regards to, what happens in the closing of the conference and agreements. And also what's very key is always time frames and accountability going forward.
100%.
Dr. Rees, thank you for your time. That's Dr. Kate Rees, a public health specialist at Anova Health Institute and co-chairperson of SA AIDS, joining us of a conference 2025, and she was joining us on the line. It is 12:30 Central African time, and our news headlines up next with Matapelo Mahape.